So welcome to our show. We had the pleasure of having Anne-Marie, and as you just saw from the previous clip, a wonderful massage. So I'm so curious. Please tell us all about how you learned, how you got into it, when you started, your path, your journey. Let's start maybe with the first one, which was very soft, I felt, and relaxing from the Big Island, correct?
So I'm French, and I came from France just to learn massage, and I went in Atlanta in '97. So I learned the deep tissue, but deep tissue, it was okay. It was my first step, and someday I really it was in 2000. And I really enjoyed to learn Iomilomi and with my teacher Makala Yates in Hawaii. I went in a school with him 2 months in Hawaii, and for me it's like my drug.
Yeah.
When I want to finish, to change, no, I come back. I come back to Iomilomi because it's healing, because it's a soft, it's a deep, and in the same time it's spiritual. We are really in harmony with the body, mind, spirit, and it's difficult to explain because mainly I told to my client, Iomilomi, I want to explain, but you need to receive,
experience it.
And after that, it's like a magic potion. We want to begin again.
Well, it feels wonderful, so relaxing. And Iomilomi, is that what does that mean?
Iomilomi is the loving touch.
Loving touch. In Hawaiian?
Yes.
And tell me about your teacher. What kind of person is he?
My teacher, Makala Yates, was born in a Big Island, and he studied a lot with Auntie Margaret, and Auntie was a very famous healer in Hawaii. Everybody knows, when we speak about Auntie Margaret, we say, where does she come from, where she lives, but she died recently, and she was very
good.
Okay. So wonderful. And then we'll just move on to the craniosacral work, which, there were subtle movements. I could feel a shift, like kind of spiraling one way, diagonally the other way. This is a totally different technique, completely different?
Completely. You forget Iomilomi, and we come really, for me it's more a technique. So we start with a firework outside.
We'll start over this.
No, go ahead.
It's okay? Okay.
Yeah, okay. We start with Don McCann. He lives in Florida, he's teaching in Florida. It's very, we do a body reading in the first to read exactly where is the body needs to work. So to rebalance the body and to restructure. It's SET means structural energetic therapy. And after that, we do some muscle testing, and after that we work on the cranial, and we go step by step, and after that, when we finish the cranial and the test is good and you feel strong, we can continue with the soft tissue. And soft tissue, it's very precise, just, deep, slow, and to eliminate every tension. It's a little painful, but sometimes very painful. But after, I guarantee we are more stable. Okay. And that's it.
The first part lasts how long? Just curious.
About the cranial, it depends. We can be very quick. It depends about how your what I feel. We go what we feel. We open the jar and work on the opening jar, and after we turn the head and we work on and we close the jar, and normally we test again, and if you are strong, we can, it's very, very, very soft, but we have to feel the bone, not the skin, the bone.
Mm-hmm.
Okay? So
this is for realignment, you said?
Yes.
So is this good for scoliosis?
we can work for scoliosis, for people who has a really big problem. The list is very long.
So that's
Yes.
great for so many people.
Yeah.
And how often would you recommend a session?
It's for big injury, acute injury, or very old.
Ancient?
Yes, very old injury, and we recommend maybe between 5 and 10 sessions to see exactly how your body come back in a good shape, and we can help a lot. Maybe sometimes forget surgery because I can tell you one example.
Sure, tell us about it.
I have my teacher, Potter. She came one time, she said, look, my finger, it's like this, and my doctor told me I need a surgery. And I said, come here, Julie. And I work on her, and she came back maybe 30 minutes after. She said, wow, I can close my fingers all. And she said, I have no pain anymore here. And I work here too, but during my work it was really painful. She was,
Right.
Yes, but it was a good work. I like this example because it's very simple, but it's working.
Good. And what is in the future for melding these? Do you work with both sometimes with clients? Or
It's difficult to mix.
okay, so you
But-
do one for more the spirit, mind, body
Yes.
alignment, and the other is maybe more for
Yes.
structural intervention.
Absolutely. It's structural energetic therapy. It's very therapeutic because sometimes when we heal very deeply, because this person, my client, come and regularly with pain, I can propose one other things. It's a breathing session. You have to breathe during maybe 30 minutes, 45 minutes.
Not after that.
Not after that. No, you never die. It's impossible because it's a good help. And my experience is I have a breathing session, and I had a pain very difficult to go away on my side left, and after this breathing session and one massage, structural energetic therapy, disappear.
Great.
So
thank you so much. Where can people find you in Atlanta? Do you have a website?
no, I
Okay.
don't. I have.
She has a YouTube present.
You have a YouTube presence?
Dalloz LMT.
Voilà.
Okay.
Okay, so let's